I feel that. And very short. Yeah, it's like. Oh, not all that right now. But anyway. I'll have to-
I got some things going. Thank you very much. I'm at a meeting right now, so.
Okay.
No. You didn't know.
Like, you all about-
Thanks.
We're certain there.
Bye.
I'm sitting here. Oh, I just don't know. That was there. Okay. What? Just. Did you get my okay.
Hey, Laura. How's your grandchild, grandson?
Right there.
That wonderful top of the world.
Already traveled internationally. He went to India.
What?
He went to India with his mom and dad.
Yeah.
Oh, like people from.
My mind.
Yeah.
Oh, right.
You know, why?
It is 12:15, and I'm going to call this meeting of the Humboldt County Behavioral Health Board to order. My name is Laura Montagna. Welcome, everyone. We are the advisory board for the Board of Supervisors. We hold this meeting on the fourth Thursday of each month, and it runs from 12:15 to 2:15. We meet here in person at 507 F Street, Eureka. This is a public meeting and everyone is invited to attend. Members of the public may participate remotely. The minutes and agenda can be found by searching online for the Humboldt County Behavioral Health Board. We provide time for public comments early on the agenda. Public comments need to be limited to 3 minutes and pertain to matters related to behavioral health. We ask you to make your comment in a respectful manner. If you have any questions, you can reach out to myself or any behavioral health board member. And with that, Joe, can you take roll?
John Berger. Here. Marguerite Story Baker.
Here.
Bob Doherty. Here. Raphael DiCaprio. Kristen Sumlin. Bob Montana.
Here.
Natalie Arroyo. Matt. Tim Doty. Here. Kelly Johnson.
Here.
Matt Kelly.
Here.
Vernon Price.
Here.
All righty. We're good to go. Are there any adjustments to the agenda? Hearing none, we will move on to public comments.
Stop, yes.
Oh. Thank you so much. Excuse me, I have missed introduction of staff and guests. So we'll start here in the room. Start to my right.
Hi, good afternoon. Emmy Boxler Rogers. I'm the Behavioral Health Director. Nice to see you.
This meeting is being recorded.
Hi, Emmy.
Hi.
Paul
Bugaki, Deputy Director, Behavioral Health.
Haley Emery, Deputy Director, Children's Behavioral Health. Sure. Alex Childers, I use they them pronouns, I'm a peer coach at the Physician and Youth Division.
Miss Austin, your coach at the Transition Age Youth Division.
Ariana Kraft, she's a member of the peer
Good afternoon, I'm Mel Johnson, I'm an analyst in the DHHS admin. And pass on
So Lopez, site director, Nation's Finest.
I'm Peter Stahl, I'm Director of Prevention and Intervention, Humboldt County Office of Education.
Do you want to introduce yourself?
Oh, okay. I'm Bryn Lamontagne. I am a peer participant at the Hope Center.
And then we'll go to online. If you can introduce yourself and then popcorn to someone else.
I'm Eddie Morgan for Tri-County Independent Living, and I don't see anybody else out there.
Yeah. I think that's it. All right. Now, are there any adjustments to the agenda? No. Then we will go to public comment. And we can start in the room. Is there any public comment in this room at this time? Online? You want to make a comment? Okay, with that, we will move on to action items. We have the approval of the minutes from 1/23/25 meeting. Does anyone want to make a motion?
I'll make a motion to approve the minutes.
A motion.
I have a correction to the minutes.
So let's get, wait,
it-
just a second, just a sec. So we make the motion, we second it, and then we discuss.
Okay.
Thanks.
I second.
Kelly Johnson, second. And are there any corrections?
Okay, under communications, number 8, it says that I said that I've toured different SUV facilities and interacted with clients. I've toured different SUV facilities, but only once did I interact with clients who came into the room and asked to do so. And that was at the transitional living. All the other places I've gone to, I haven't been around clients at all.
Thank you.
So how would you change it? Take off the S and say it. Okay,
All right.
make sure we get it right.
Are there any other corrections?
I have one, it's very minor, but on number 10A, care court, it says Kelly Johnson reported that a UIHS client, and instead of UIHS client should be your tribal member.
Joe. Yes.
I guess correct something I said. Just I noticed that throughout the minutes, the pronoun she's in frequency, I use.
Alex, Dave, Don. All right. Thank you.
Excuse me, sir, are you lost?
Yes, I am. Always, aren't
But
we all?
you've been found.
But now I'm found, so feeling much better. Sorry I'm late.
Okay, here.
All right, so with those 3 corrections, anything else? I will call for the vote. All in favor of approving those minutes, say aye, raise your hand.
Aye.
Opposed? Stand aside. All right, those are approved. Thank you very much. And now, the moment you've been waiting for. We have our presentation on crisis services. You're up.
That's fast.
I know.
Early. Where would you like me to stand? I'm not quite sure where the best place is for you.
Wherever you're most comfortable.
Well, I'm most comfortable in the chair, but.
Make sure to speak loud.
Right. Well, thanks everybody for being here. I'm gonna talk a little bit about our crisis continuum of services for county behavioral health. As I introduced myself earlier, I'm one of the deputies, and some of my programs are the crisis programs for the adult side. And I also have a few other projects and programs that I oversee, like our performance management unit, and all of our forensics, justice involved programs to oversee. So, but I have to say, you know, the crisis services are the thing that I've been involved with, I think, most of my career. I started on a crisis line, a teen runaway hotline. In fact, that's where my wife and I met, so, you know, it's a big part of our lives, so. Anyway, I'm happy to be here to talk about this today. This isn't working. Yeah. Try it again.
Can't get it.
Good, just advance the slide for me. Alright. So the continuum really starts from a crisis call. I mean, crisis calls, somebody reaching out or somebody asking for help, or somebody asking for help for somebody that they know. So, you know, it starts there, typically. So crisis calls are a big part of what we do. We also have clinics throughout the Humboldt County, and you know, they're a part of our system and our process for crisis as well. And we also have mobile teams that go out and respond to crises. So I'll be talking a little bit about those mobile teams that go out into the community and provide services to those that are in crisis. And then we have subacute programs in our county, and we have acute care. We're fortunate enough to have acute care in our county to those that are in need it. Go ahead and advance the slide. Joe, thank you. Is it working? All right.
Ready to go.
Maybe aiming over at, aim at Joe, not at the top.
All right.
Yeah.
Give it a try. So yeah, like I mentioned, you know, 911 has been the go-to for crisis calls. Those go into dispatchers in counties, and then from there, law enforcement is kind of the one that's going out and responding to crisis oftentimes. So we've been fortunate enough to have mobile teams that could respond out into the community at different times during our existence. You know, but most recently, we lifted back up a mobile team back in 2018, I believe, or 17, 18. We've also had other collaborations with the city of Eureka, the EPD, where we've had teams collaborating on joint responses. So now we're fortunate enough to have 988 available to us. So a simple 3-digit number like 911 that people that are having an emotional crisis or even a SUD related crisis, a substance use disorder crisis, could call or text 988 nationwide. So we have a number of call centers that 988, those calls go into. Some of our closest ones are the North Bay area and down in the Bay Area. We also have one in Sacramento, and then throughout the state. I believe there's 11 in the state that when I last counted in California. So California's a lot of call centers for 988.
I recall there were mobile units in Fortuna and McKinleyville. Is that still the case?
Mobile units?
Yes.
Yeah, well, our mobile team will respond anywhere in the county. So they deploy from Eureka. So I just wanted to give you some, so we also have a crisis line. We've had crisis lines for a long time in our county. The 7715 number here locally rings right into our 720 Wood Street. This is our main hub for crisis services. So that's where Semper Virens is. That's where our crisis stabilization is. So those numbers ring right into 720. And we have staff on the CSU or crisis stabilization unit that end up managing those calls mostly. We also have same day services that manages those calls during regular business hours. And those two teams support one another. So during regular business hours, the same day services staff will manage those calls. And then after hours, the CSU manages those calls. Vernon, did you?
Would you like us to wait till the end?
Either way,
Questions
I'm
or-
okay either way. On these, I have maybe 10 slides, so it's not a lot, and hopefully we'll have
As
plenty
we
of time.
call the crisis stabilization unit, do you still have an answering service that answers? And because I do know that there's been times I have used the crisis stabilization and other people have used it that live on the street here in Eureka. They get put on hold, from the answering service.
Yeah.
And that's kind of difficult in a crisis situation. So I didn't know if that has been resolved or if that was still in operation or.
Yeah, I would
What
agree
that
with
was
you, Vernon. It's not the ideal. We have that service, in place until June of this year, and then we are, not renewing that contract, and we're gonna be managing the calls entirely. So no answering service for us come July 1st. So that'll be our teams that'll be managing that.
I'm gonna just suggest, because I think it might be more efficient for our group, if you just go through your slides, and then we can have like deeper dive conversations on any of these items, because I think there's probably lots of things that this is gonna spur in terms of thoughts and reactions and questions.
All right, sounds good. So, so those calls coming in, we have an 888 number, that's a toll-free number. You call anywhere, comes right into our call center, at 720. I just wanted to give you a sense of the call volume that we have. We did a call volume study in 2022. For a 6-month period, we had 7,876 calls into these two numbers. That's about 43 calls a day that we receive. 2,929 of those were received after hours, so between 5 PM and 8 AM. Those numbers. So that's about 16 calls a night that we received. And interesting enough, the busiest call times were 11 AM to 1 PM on Tuesdays, Wednesdays and Thursdays. Anyway, interesting. So just for comparison, EPD's CSET, responded to 1,143 mental health calls in 2022. Currently, their 911 is managing about 29,000 calls, in this last year. Thanks to the chief who, did that presentation to the city just this last week. So I lifted those numbers from him. So, also, I just want to mention that the 988 number, when, if you look on their website for 988, the Lifeline Society, Prevention and Lifeline number, they boast about 98% of their calls they're able to manage over the phone without having to deploy somebody to do an in-person response. Thought that was a fairly impressive statistic there on their part. So they do a lot of training with their teams, and we do a lot of training with our teams as well. So we train our staff. Tobias Griggs, our supervising clinician on Semper Virens, and he's over this crisis or stabilization unit as well. He produced a really nice training that provides a lot of practical skills for the call handlers. A lot of evidence-based practices around call handling, and managing crisis. So he's been, anybody that answers the phone or interacts with the public at 720 Bush Street, takes that training and is trained in that way. And we also provide a lot of backup support with clinicians to the crisis line should that be needed. So, like I mentioned, we've been expanding services and trying to get our services out into the communities in our county. So we have sites in Fortuna, the center in McKinleyville now, Willow Creek, and now in Humboldt. We have a site in Garberville, so we're really trying to expand our service delivery system to the in the out areas of our county. But crisis can happen anywhere at any time, and people go into crisis. So there's no wrong door, really. If you come into one of our service centers, we're gonna help manage that crisis in that moment with that person. So, even if it is just, here, let me see what you need and let me get you connected to somebody that can help. It's something that easy, but really we take that approach and no wrong door. If you're calling and you want something and you happen to call, older adults, we'll definitely connect you to the right folks to help manage that crisis. Hopefully we won't put you on hold for too long. We also have, a pretty good network of providers. We have organizational providers that we contract with that provide services. And like in children's, we have quite a few providers that provide counseling services and well, sometimes in schools and sometimes at their centers throughout the county. So we're fortunate to have some really good long-term relationships with these organizations that provide really good quality care. So they're part of our network provider. So our mobile response team. So right now we have one adult mobile response team as a clinician and a case manager. That's filled positions. We also have children's clinicians, 2 clinicians that have been taking turns responding to crisis, as well as case manager and a parent partner that's then providing crisis response on the children's side. So we have 2 mobile response teams. We have open positions. We're trying to hire more teams so that we can provide more coverage instead of just those individuals. And we also have the mobile interventions and supports team, our MIST team. So we have 1 team there that provides mobile response too. So the difference between mobile response team and MIST, mobile response team goes into the emergency departments to evaluate those that have been placed on holds on 5150 in the community, whether it's by law enforcement. They come into the emergency departments. We deploy out to assess those individuals to make sure that the hold is it's a good hold. It's warranted, and or if the person can be worked with and create a safety plan for that individual that's sufficient and get them connected to needed services to avoid having to go into a higher level of care unnecessarily. So that's what the mobile response team does. It's very specific into the emergency departments. All the 4 emergency departments in the county that they respond to. The MIST team responds everywhere else. So anywhere in the county, the MIST will go. Sometimes they might be down at Shelter Cove, and then later in that day, they're up in Oric. So we have a team there, and we have positions for a second team that covers 7 days a week, fully. But right now, those positions are vacant. So if you know any friends that are therapists, peer coaches, or case managers that want a job, send them over. We'd love to hire them. So we're trying to expand out our MIST program and coverage there to go 24/7. Right now, they're covering 7 days a week, but we're not quite covering around the clock for MIST. Well, we're hoping to get there soon. So I just wanted to give a few statistics for 2024 for these teams. So the mobile response team made contact and assessed 571 individuals in last calendar year. Those were adults. So in the children's side, they saw 92 individuals in the emergency departments. The MIST team saw 140 people last year out in the community. So total, we had 673 individuals that had some contact with one of these mobile teams last year. So that's a total of 1,582 interactions or contacts that we've had. So it's not just one and that's it, we don't see you anymore. It's one with the initial and then several other contacts to make sure that folks are connected to needed services or follow-up care. Because we found that when you're having warm handoffs, when you're in crisis, is critically important. So that's where our case managers and peer coaches are. So we have a high number of those contacts post initial contact with individuals. So the other part I wanted to mention too, when people come into the emergency departments, when they're having a crisis. The hospitals, the doctors, have a legal immunity clause like counselors do for 5150. It's a code number called 1799.111. It's a welfare institution code or health and safety code. Health and safety code. So that gives the doctors the ability to hold somebody in the emergency department if they're worried that they might be a danger to themselves or to others, or they're gravely disabled. So doctors have been using that and then notifying us, and then we come out and assess those individuals to see if they need to be brought into higher level of care. So last year, 445,1799 in the county from our emergency departments, from our doctors. We also give our doctors permission to write and rescind 5150 holds if they're trained and they get certified by us to do that. So there's a number of doctors in our emergency department that have done that, especially at Providence St. Joe. Which we have a really good working relationship with, Dr. Hunt and Dr. Kramer and a few others have been really wonderful to work with and collaborate with. So of those, 445,1799s, we had written cumulatively, doctors and our teams, 1,033 5150 holds in calendar year 2024. So last year. So of that number, when we reassessed those individuals, 520 of those didn't meet criteria for a hold. So for instance, if a law enforcement officer was interacting with somebody that was having a crisis, the law enforcement officer thought that they were maybe a danger to themselves, they put them on a hold and brought them to the emergency department. Our team came out and assessed that individual and determined that they could safety plan, they have good support system, and they were able to be rescind that hold and be treated in the least restrictive environment as possible. So then that hold would be rescinded. So we did 520 of those last year. So that's roughly 51% of the holds that we assessed were able to be rescinded and treated at a lower level of care. Really critically important, I think, to notice, because we want to treat people in the least restrictive environment possible. We don't want everybody going just right into SV right out of the gate. That's, we're using beds on SV that maybe we don't need to, that maybe people would be available to somebody else in crisis that needs that service a little bit more critically. So it's an important part of our system of crisis care is that mobile intervention, free folks going to SV. So who can write holds in our county? Clinicians, nurses, psychiatric techs that work for our county, our doctors, and then in the community emergency department physicians, and there is a provision in there for community-based psychologists and also sworn peace officers. So all those individuals can write in holds. Emmy is the holder of that privilege to designate individuals to be able to have that ability to write and rescind holds. So it's really a delicate balance between, somebody's civil liberties and keeping somebody safe. Do I hold somebody against their will? Can I do that safely? Because we're basically, taking away some civil rights for a period of time. So that's a critical responsibility that our teams have to judge and to manage. So they do that in collaboration with other licensed professionals that are on the team. So we also we're trying to expand our providers that are providing crisis response with us. So we're in communication with several entities, including some of our travel partners, to join in with us to be a part of this team, so we could have a regionally supported, quicker response in areas than what we have right now. So that's continuing. So the next level of care is a subacute care, and the crisis stabilization, our 4-bed crisis stabilization unit, is an example of that. So is Hyperion, our adult crisis residential program that we just introduced with Will Glenn this last year. So that's a 10-bed site. So these are what we would consider subacute, not quite acute, but definitely needing some additional intervention for a period of time. So our crisis stabilization unit, you can stay on that unit for up to 24 hours. The state will reimburse us for 20 hours of that, not the full 24 or anything over that. So in Hyperion, you can stay at Hyperion for several weeks. And then there's other types of services, not quite, I would say, subacute, but I put them here because they're an important part of the process. So if somebody maybe needs additional supportive care once they leave Hyperion or their crisis stabilization unit, maybe they might be appropriate to have some of that additional support at Lighthouse. Or maybe they need additional treatment for their SUD challenges that they're having or experienced with waterfront. So there's these other entities that are part of our community that we're so fortunate to have that are really important for this, for folks that are in crisis with a lot of different needs. Okay, now, and we have Crestwood. Crestwood Pathways is a mental health rehab center. So this is a 43-bed unit here in Eureka. So Crestwoods are throughout the state. There's several, there's many of them throughout the state. So they have lots of different types of services. They have an adult residential type of service as well in Crestwood Pathways. But and that's a 15-bed unit for Pathways. But it's a transitional short-term 18-month program. But people stay on site for that, but it's not a locked site. Okay, and then finally, the most complex and highest level of care that we're able to provide in our community is happening at Semper Vire. So that's our 16-bed acute psychiatric hospital that's been around for over 50 years. So we're very fortunate to have Semper Vire as part of our crisis continuum. When I was in Butte County, before I came out here, people talked about Semper Vire as something that was like unique and special, and not very, that was a real standout. So that always piqued my interest when I heard about Semper Vire. So it was part of the reason why I was real interested in coming to Humboldt. Yeah. Okay, where am I? So yeah, we're one of two county-run acute psychiatric hospitals run in the state. So Santa Barbara is the only other county that is running a 16-bed acute psych like we are. But there's a lot of scrutiny, like as you may know already, with having that designation. We're reviewed by the Department of Healthcare Services every 3 years or whatever they want, and the Center for Medicare and Medicaid Services every 3 years. So very stringent, just like another hospital, they hold us to the same categories as a regular hospital. So on SV, we had this last year, we served 275 individuals. The average length of stay on Semper Vire for folks that are not conserved is about 12 days for last year. For folks that are conserved, their average length of stay was 94 days. So I like to separate those out because it tells a story about folks that are conserved. It doesn't necessarily mean that they have to stay on SV because they're acute. or 94, an average of 94 days. They could probably stabilize in 8 days. But if we can't find them an appropriate subacute step down, they stay on our unit until we're able to find an appropriate level of step down. So, again, talking to the importance of the subacute portion of our continuum. And Crestwood is the mental health rehab center here in Eureka, 43 beds, large facility. They've been around for a long time and been a great partner with us in providing care for folks in our community. And I would say, and we're finishing up right now, but the state has issued grants over the last 5 years or so in different rounds to try to build out the infrastructure for psychiatric care, because there hasn't been investment in the infrastructure for psychiatric care forever. I mean, there just hasn't been there. So kudos to the state for putting together a lot of money in different rounds. So we benefited from some of these rounds. Round 2, we've benefited from, that helped us with our mobile crisis team. Round 3's helped Sorrel Leaf start to stand up their kids in crisis residential. Round 4, we've been, some of our tribal partners have taken advantage of round 4. Round 5, our Mad River Crisis Triage Center. We were awarded some money for that to creating a stand-up. So really appreciate the fact that the state has been given money to build out the infrastructure. It's been so direly needed. So on the horizon, I would just say that we are looking forward to breaking ground on our crisis triage center up there at Mad River Hospital. We're really excited about that because it's filling gaps that we've had in our system for a while. So we don't have a sobering center. We're limited in our substance use disorder treatment. It's going to provide some of those services. It's going to also provide crisis stabilization, but in a way so we can flex to treat minors and adults at the same time, whereas we have a harder time doing that in our existing facility of supervisors right now. It's safe and for this issue just because of the space. So that's going to really help us out a lot in our community. So Sorrel Leaf, as I mentioned, V-chip round 3, they're under construction right now, and we're excited about that and working with them. We've also applied for plans for some money to rebuild Semper Virens, and we got plans for that. So we're waiting to hear back on that application. We should be hearing back anytime now. So we're excited about that and the possibility of having a new Semper Virens across the street from the courthouse, possibly. So keep your fingers crossed. And there's other things on the horizon. Senate Bill 43, which expands the criteria for grave disability to include severe substance use disorder issues. So we're creating a steering committee, a work group to help our community figure out how we're going to navigate that. That comes into play in January for us. And of course, the Prop 1, as I mentioned, with the dollars for new Semper Virens. So all of these things that I've talked about, we've really expanded and increased our bed capacity. So things on constructed, we're going to increase our beds by over 6, which is an enormous increase for us, but it's in line with what the state has designated as what our need is for our county. So we're really looking forward to these other gaps being filled and for infrastructure being built to help us into the future with managing crisis. So with that, I'll end for any questions that folks might have. Thank you.
Going first. Steve.
Thank you, Chair. Well, first of all, Paul, thank you, and to all the staff at DHHS, the behavioral health partners here. I just want to say thank you, because these are not easy times. Seems like we're all more and more in crisis. I don't know about you, but I think we all get up in the morning with mental health crisis and try to put one foot in front of ourselves and go back out there and do what we can in this world of ever changing times and funding and everything. And I just want to applaud you for the hard work that you do. It's not easy. Funding's getting more difficult. And I am so excited about the idea of separate environs. You know, since I came on the board, it struck me right out of the gate that we own this entire parking lot across from the courthouse, this entire block. And what do we use it for? Parking and public health, great services there at public health, but we can have parking still with another building or separate environs there and things like that. And a lot of the problems with separate environs are, as you said, it's 50 years old or older, and that's hard on staff, it's hard on the clients. So that is super, super exciting, along with the triage center and Arcata.
Yeah.
The questions I have is, I'm still learning things. So is the crisis line really an 8 to 5 thing, and then after hours, it's 24/7?
24/7.
Wow, that's phenomenal. And as you said, Vern, you know, get rid of the answering service, because if you're in crisis, just hold here, you know, it's like, that's a tough one, right, on every
I'm
level.
not trying to throw
No,
a
of course not.
rubber ball, into something that's doing a wonderful job.
It's great input.
But we definitely need to look at all the aspects.
Yeah.
Because 3 nights ago, I'm sitting with an unhoused person in an alleyway on the verge of calling the crisis line. And this was 11 o'clock at night. So, I mean, that would be a very sensitive situation for an answering.
Yeah.
Or an answering service, or we put on hold.
Yeah, absolutely. Well, thank you for bringing that up, and that's one of many values that you bring to this group, so thank you for that, Bernie. Anyway, that's really all I had, was that question about 24/7. Again, thank you all for your incredible work in this tough time.
Kelly,
If a person calls the Humboldt County line versus the 911 and the 988, and they obviously have a substance use disorder crisis, what generally is the path that is taken by whoever answers that line?
Well, it depends. If they're in crisis, we're gonna work for crisis. So we might see them, we might bring them in, we might set an appointment up right then, or have them walk in, depending on what time it is. I mean, you can walk up to CSU anytime. It's, you know, we can respond 24/7, from the CSU. Or if, you know, they, want to, I mean, they can, we'll connect them to partnership, and doing the screening for kind of their level of care that they do, and then get them connected, that way. So either way, we try to make sure that we're just take care of the need right there, not have them, you know, not push them around to another door, but help them get to where they really need.
So there isn't a direct line with like waterfront when people call in, that they're not referred by that person to another facility. They're talked to by your own staff and like
Right.
that.
If they're expressing an immediate need for things, we're gonna try to work with them as best that we can. But if they're like, no, I'm good this week, you know, I've got things to do today or whatever, but I can follow up tomorrow. Something like that, we might connect them, you know, give them the number for partnership and have them call, or we might do it with them. So it just really depends, case by case.
Thank you.
Kelly,
I just am curious what the plan is for when the answering service goes away. In terms of like, will there be a dedicated staff member answering a crisis line after hours? Because I know in the past it's been challenging with the rotating staff on the crisis unit and varying levels of skill. And also they're dealing with people in crisis, so being taken away from their regular duties to answer the crisis line can be a challenge.
Yeah, we've shifted to a designated call handler on the CSU, and they're managing the crisis line. And we're talking about what that's gonna look like, moving forward. Does it make sense to add another task for the CSU staff to do that isn't entirely reimbursable for their primary focus, work on the CSU, then maybe we need to bring in another type of staff to provide that service. So we're have a meeting this afternoon to continue that discussion to see what's the best way to approach it, and the most efficient way to approach it. Yeah.
Questions online? Any other questions in here? Put your hand up. I'm short. You can't see. All right, well, I have a quick question. I'm sure, do you keep stats on like the groups of people who place holds? How many, what percentage are law enforcement, what percentage?
Yeah, yep. We keep all those percentages and how many of their holds were actually rescinded or upheld, so we get pretty detailed statistics on those.
That's interesting.
Well, it's been helping us to be able to train those individuals to about, you know, what. Maybe it's how they're writing them, maybe that isn't, you know, is it working or something? So it's an opportunity for us to collaborate with our community partners.
And of the holds, are those unique people or like, are there some people who come back and back?
Yeah, those are unique individuals, so there could be, repeated, holds on that. Those are-
Okay. And I don't, a lot of times I get asked the question, you only have 16 beds, why don't they just add some? And I just want to reiterate that a lot of people don't know. That's fine, well,
To do that.
Yeah, it's the licensing type, so we're licensed as a psychiatric health facility, and that limitation is 16 beds. So if you go over that, you enter into this thing called an IMD. It's an institutional clause that, you know, starts to impact your ability to build. So it's a different funding stream and different funding sources and different requirements. So, you know, it's licensing specific.
Plus, if you have a child there,
What's that?
plus if you have a child that comes in, don't you have to give people up?
So we have to what?
Ask people to leave?
Well, currently, yeah, we won't ask them to leave. We'll transfer folks if we have somebody on the unit. We'll have to transfer folks over to separate environments so we can not have commingling between a minor and adult. And that's one of the reasons why we have limitations with our current building is that we can't flex like that. We have to actually move people to another unit. So it's, you know, the new design that we have with SV that we've created allows us to exercise the waiver that we have from Department of Healthcare Services to treat both adults and minors at the same time. So we can do that in the new facility with separation, which is nice. Right now, we can't do that effectively in either units. So, you know, youth are going out of county when they could be treated in county, for instance.
And I'll just add, Paul, that the design of the behavioral health crisis triage center also takes that into account so that we can have that flexibility.
That's right. We can go up if we have, or down if we don't have a lot, and expand the adult side. So it's really nice. Boulder and Associates has really been great with the design ideas to help us be flexible.
Somebody else. What's your connection with Cal Poly and their mental health services? I was just talking to someone whose son needed evaluation on Cal Poly, and I didn't know they had that kind of services. So I'm assuming you're pretty collaborative, but can you just say
We
a little
are.
more?
Yeah, we've been having more communications with them, and we're actually trying to arrange for them to do a tour of Central Environments, our crisis stabilization unit. So we've been going and talking with them and collaborating with them. So hopefully, you know, when there is a crisis like that, they can call us and we can assist them in evaluating it.
Steve has another question, and then I have another one.
Thank you, Chair. It's a survey point, I guess, in the sense that during the pandemic, I was getting a lot of calls from the hospitals, especially in that river, about the 5150 syndrome. I'm not getting those anymore. I haven't gotten any for several years from either hospital. Now, that doesn't mean they're not already always still understaffed, overworked, like our own workers are in DHHS, like you pointed out, Kelly, about how does this work? We already have all these duties and then there's this other thing, right? So none of this is easy, but that's a data point. I would say that whatever has gone on, it's an improved system. Of course, COVID was a big part of all of that. But I think the cooperation between the law enforcement agencies and the hospitals and DHHS has, you know, there was things that came up that have been worked on to improve. So I would offer that as a data point. The other thing I wanted to say is that I think we all wish there was a whole lot more services on every level, right? But we only have so much resources to be able to do things. And we just had a presentation this week from the Department of Behavioral Health, from Emmy and Paul and others on, you know, the budget and what the plan is, et cetera. And if I heard you correct, there's been a reduction, there's efforts to reduce some administrative staff to make more room for direct services providers. And I applaud you for that. It's not easy, but that's one of the things that has been being brought up by staff and others. So if you want to blame somebody, don't blame Emmy and Paul and especially not the direct service providers. Blame me and our board because, you know, it's really our responsibility in the budget. I wish there was a better budget scenario. It's horrible. It's really looking really bleak for the next few years. And with what's going on currently at the federal level, it's not looking better by any means. So, but we're all in this together and, you know, we will do our best. We're going to survive. We're going to make it through. And we're going to just continue to do our best with the resources that we have. So again, I applaud you all because if you want to blame somebody, call me, blame me, you know, take it out on me. Okay, so whatever. So say it.
Thanks. Steve,
Yeah, you're welcome.
what's your number?
Yeah. I might be calling the crisis line. Yeah, my number is 572-0052. 572-0052.
That's somebody else's number, right?
Yeah, that's your number, Tim. I had a direct dial here. for Tim Doty.
I have a question or a comment, and it's something I wish I had more time to drill down on, but because we have a lot of services here. I don't know if you realize that compared to world, but Humboldt County has a lot of services, so a lot of people get sent here. So do you track out of county, people who are sent here from out of county? They might be sent to a program and then they fail out and they're still here. Is that something that ever gets looked at?
Well, I mean, Paul might be able to respond to that as well, just from some of his unit tracking. But I will say, you know, like there's lots of different categories of when and where people move between counties. So for instance, Drug Medi-Cal Organized Delivery System, we have individuals throughout 7 counties that intentionally are meant to travel between counties to get services. With children's, we have presumptive transfer, and I would venture that we actually send more kids out of county than we get coming here. And with adults, I'm not quite so sure about that. I know we send a high number of individuals out of county, or historically we have, because we don't have the services locally. Whether or not we have people coming in, I don't know if people are necessarily sent here for services per se, but I know that, you know, certainly people show up here or are here for other reasons and then get services here. But I don't know if we have data points on that, Paul.
I mean, we check, you know, where people's Medi-Cal is, you know, for everybody that we come in contact with. I would say that sometimes it happens if like with the, at Crestwood, the MHRC, sometimes another county might send one of their conservative individuals for treatment there. And sometimes that doesn't work out. And sometimes they blow out and we're in crisis. And then we work with that individual and that county because they can't go back to Crestwood to find a solution. So when those things happen like that, we do collaborate a lot and try to work out, because that's, you know, that could be a sticky situation for everybody involved. So we really try to lean into those and prevent that from happening and preventing any problems from that blowout. Just want to make sure that person's connected with services. So it doesn't, I mean, I wouldn't say it's We don't have a huge influx, I think. You know, most folks that we're treating are Humboldt County Medi-Cal beneficiaries.
In my work, I'm seeing a lot of people from out of the area, and so I'm getting, you know, trying to help them get back to somewhere where they have support. So that is interesting. You want to drill down on how they have it. The next.
So. Should people, if they're being kicked out of treatment, be given the opportunity to call a cab to return to where they're from?
I think if
Because I'm not seeing that happen a lot of times. I see what's happening is people are being told in big complete treatment, you're not entitled to that cab. And so,
may I respond?
yeah,
Do you mean like in substance use disorder treatment? So, and Robert might know this better than I do, but my understanding is if partnership is paying for their treatment and the person voluntarily leaves, then they're no longer eligible for the transportation benefit.
which
I
means a
believe,
lot of people get stuck here.
yes. Is that your understanding as
Yeah,
well?
Providence has paid for, you know, people to go
Yeah.
back to their county because they just have no other means and TAP takes
Yeah.
a while, so.
And
yes,
sometimes-
unfortunately, that's the case, and it does happen, you know.
Fairly, yeah. I've utilized Betty Chin for
But the
emergency transportation funds.
But tax will pay for them. It takes a few days,
If they have,
somewhere to go.
yes, and can confirm, so TAP and B.
Yeah.
Doesn't work
I
for
just-
everybody.
I thought it was odd. These people trying to get us stuck here.
It is an issue that
Yeah.
I've come across as well, for sure.
But when I lived in San Bernardino, when I worked for, I did boots on the ground, outreach, the girl I worked with used to tell people, oh, why don't you go to Humboldt? They'll let you stay anywhere, so. Just saying, it happens everywhere. But then here I am.
Another question, Barbara?
So if a person qualifies for treatment at SEP environments, but they're definitely a dual diagnosis SUD person too, do any SUD services get integrated into the SEP environments program?
Yeah.
Or do you kind of defer that and try to destabilize it?
No, for sure. We address all the issues, you know, we treat the whole person. So there's, I mean, primarily, we're working on the mental health related issue. But, you know, there's a good number of folks that have both things going on. Sometimes they have physical things going on too that need to be managed as well. So we'll do that too. As long as we have the capability to be able to manage those conditions, we will. Like, we don't do induction of any kind of medication assisted treatment on the SUD side, for instance. We could, but we've got, you know, there's other providers in the community that can do that.
So some of the providers of Matt come into SEP environments too?
Oh, yeah.
Oh,
Yep, for sure.
great.
Yep, we've had, you know, other folks that are in other forms of treatment in the community that are also treated on separate environments, and we collaborate with those providers, and because we want those to continue, so.
I've also been started, I'm sorry, but I've also, we've also started to focus on, human evidence, you know, that confidence before they go into.
Yeah.
Something that we should have.
Thank you.
Yeah.
Well, I'm super excited about all the stuff coming up for youth, because the more and more I see people in my line of work, they've suffered since they were young, so I think that's really exciting. And super proud, as I always say, and I will continue to say, of our county and the work that we do. Thank you all. And with that, we will move to communications. This is a time for our behavioral health board to communicate things that they want to share. So we will start on this side with Raphael.
Overdoses are continuing to go down. We had 5 accidental overdoses last month. That's awesome. But our numbers are still very, very high. Alcohol is still king, and we're still trying to get very creative with placement for detox withdrawal management.
Oh, hang on a second. Steve, did you have anything else?
No, I think I've shared what I like.
Okay.
Yeah.
Sean.
My name's Danette. I am, I have a couple of things I'd like to talk about. First of all, as, member of the board, I think, it's really important that we talk about, we're at the first and forefront of HIPAA. And I know that people don't really think that we need to be, following HIPAA rules. But it starts, all that stuff starts with us. So I want to talk about, what that covers. It covers healthcare providers, health plans. It covers patients' information. It covers where people live. It covers people's names, covers all kinds of stuff. And I want to share that when we share people's names in this meeting, when we're sharing our reviews or whatever we're sharing, and we have community members on that screen, we are sharing people's information with the community. I'm not trying to be anything, but like, I just want to make sure that we're being mindful that our professionalism, that we should be role modeling for people that work in our community should start right here. People may not like me, but recently, there's been a few things that I've said that HIPAA is important to me. I don't play with it. I don't play with people's mental health. When you go into someone's house and it affects one person, when you're going in, you're going in to visit somebody's house and it affects one person because they're uncomfortable when you visit, it's one person too many. And so, I just, like, I have a huge heart for our people, whether they be houseless, mentally ill, TBI, anything, trauma, anything. I just have a huge heart for trying to get out of myself and think about how somebody else is feeling and not just think about me. And so, I just want people to start thinking about, this isn't about us. We're here to learn how to help our community. And if we're not thinking about HIPAA, we need to role model that. And so, with that being said, I'm gonna, I had a couple of epiphanies recently. I had a social worker call me earlier this week. Working with one of my people that's intellectually disabled. She took over about 8 months ago and she's like, I can't do this. And I'm like, well, why not? And she told me what's going on. I'm like, that's part of his disability. She goes, well, what's his disability? And I was like, really? And so it made me start thinking about how, maybe once a month I have some, we could have like an educational day. We could, teach people about intellectual disability and how it affects mental health, because we have people in our community that are RCRC as well as mentally ill. We have people that have TBIs as well as mentally ill. Maybe have some educational thing on a Saturday or whatever. But we need to start teaching our people in the community, because
we're just looking the other way, and it's not just about mental illness. And even at that, a lot of people don't even know the symptoms of mental illness. And so I'm hoping that somehow we can get together and have some educational for the community on what it looks like, and about it, because that was pretty scary. Like, you don't even know, you don't know. And so just an epiphany of thought, and I hope that everybody's on the same page of doing better for our behavioral health in this community, as well as our substance abuse. I know you all are, so sorry if I pushed too hard. Thank you.
Thank you for that.
Hi, everybody. Got a lot of things going on here in the last couple of months. I'm the chair of the Native Veterans Coalition. And we are in rapid progress of developing our own website. Come to find out, there's a lot of distrust in the Native community with anything that's connected to the government. So the Native Veterans Coalition started out as a concern from the United Indian Health Service and the VA to bring about a coalition. And so the information that we're doing with that is we're working on getting a separate entity away from the VA.
That's awesome.
And so we've got some talent from our other coalition partners who are really working on that. May run into some funding problems, maybe not, but we're actively getting some board members and all the things that you need to, work on 501c3. That's a separate entity. So the other thing, I went up to Crescent City a couple of weeks ago for something called a Veterans Cafe. They do it about every 3 months, in collaboration with the Oregon VA, social workers, and Crescent City people. And what it is a place that they come together about every 3 months for 3 or 4 hours. It's a place for veterans and community to come together. They feed us. They have a presenter to talk about maybe some different benefits or some aspect of being a veteran there. And it was a big turnout, bigger than they thought it would be. There's probably 50 people in the room. And the Veterans Coalition here is also looking at the possibility to get that started here. So we're trying to get that moving along. And so I got the flyers here, all these, but we have had for a while a women's coffee veterans chat. It's once a month. I'll leave a flyer. It starts out over here at Old Town Coffee and Chocolates and moves to, we have a conference room that's been offered through Nation's Finance at 211 F Street. So we moved down there, and it's a couple of hours. And now it's followed by some men's after that. I'm offering to do the men's portion. And so I have flyers for all of that with dates and contact information. And then the 7th of March, there is a Healing Drum Circle Conference, sponsored by UHS in Crescent City. So I'll be headed up to that. I also have a flyer for that. I'll give all this stuff, but you can publish it with the links.
That's awesome.
Awesome.
Good share. Thanks. What's going on? Well, Reed Johnson.
I have a handful of announcements. So those of you that don't know me, I currently work for the Humboldt tribe. I am responsible for coordinating the crisis intervention teams in both Humboldt and Del Norte counties, and that includes our 40-hour trainings for law enforcement and other crisis responders. And so I wanted to report that I worked collaboratively with Leah Nagy from NAMI, and we applied for a grant and were funded to send 2 people to the CIT coordinator course, 1 person to a 4-day CIT curriculum train the trainer course. in 2 NAMI members to go to the CIT International Conference in August. So we met yesterday to do our first quarterly report, which identified folks that are going to attend each of those things. So that's very exciting. We also obtained funding from the Humboldt County Community Corrections Partnership to send 17 individuals from various law enforcement behavioral health agencies in Humboldt County to go to the CIT International Conference in August in Anaheim. So DHHS, Laura Coulter over there, is helping to arrange the travel for all 17 individuals, which is a huge heavy lift. And so I really appreciate DHHS's support with that. And thinking about what Danette was saying about education, CIT is a great opportunity for education. So I will email Joe the registration flyer. Our next training's coming up in April 14th through 18th here in Eureka at the Warfinger Building. Europe Tribal Police in collaboration with Eureka Police are co-hosting that training. Oh, my phone is listening to me. That's weird. Anyway,
Alexa? No.
I know, I'm like, what's happening? So I just released the registration for that last week. I also released the nomination form for CIT Responder of the Year, which we really like to recognize people that are doing this work, that are doing it well. Effectively, I've already received 2 nominations, which is wonderful. So I'll also include that when I email Joe with the registration flyer. And then lastly, other educational things coming up in May. People are preparing for May's Mental Health Matters Month. I know the city of Eureka is planning an event to kick off the month, and they're working on bringing the presenters together for that. And I've already heard from the Hope Center folks around the barbecue that will be happening at the Jefferson Center. Our CIT group will be tabling there. And then also I encourage everybody to participate in the walk as well. And I'm sure we'll get the calendar once it's released to this group, but I just highly encourage those of us that are here to participate in as many of those events as well. That's it.
Who's coordinating the walk?
The Hope Center.
Oh, the Hope Center.
Yeah.
They've done that.
There's
before.
Oh, it's a group.
There's a committee that's, is formed by the Hope Center that is putting this together.
Thank you, Brian. Thank you. I don't have any today.
I'm like Ms. Johnson. I have a handful of things. March 10th, we have myself, Arcata House Partnership, Dr. Darlene Sporn, and her executive assistant, Florence. At 2:30, we're doing a meeting with Christopher of Stand Against Stigma, Brave Faces out of Reading. He will be coming up here in May to do a Stand Against Stigma, Brave Faces training to teach people how to tell their stories in a productive, proactive way. What we will be doing immediately thereafter is setting forth a community event of a speakers bureau of trying to reduce stigma and stereotype that comes with mental health. What's disheartened is that no one from county mental health and no one from this board has been supported. That's, well, I have given Brave Faces, you couldn't come to a conclusion of what I'm talking about. So, you know, maybe someone that we can bring up from Reading can answer all the questions. He's the director of Brave Faces. I have worked with him on 3 other occasions. One of those is a YouTube thing of I was homeless. That has been a very popular.
What day is it?
It is March 10th at 2:30 p.m. That's a closed meeting because we're just, Dr. Darlene Sporn, myself and Florence is getting together how much it's gonna cost for this. Arcata House Partnership is backing this financially. So just keep us in your hearts and your thoughts, and this goes over very well. Yes, sir.
Is it called Brave Faces?
Brave, Brave, Brave Faces. You can look up Stand Against Stigma, and Shasta County will come up, and Brave Faces comes up underneath Stand Against Stigma. They have reached 5,700 individuals since their inception. If we can get half of that, reaching the community of half of that, we can at least change the tide, if not the narrative of the way mental health is looked at today. I say that very passionately because I am a consumer. I am a person. I saw a hand.
So Vernon, what would support from the board look like?
A report from the board, there'll be
Support.
a letter of support of something of this nature, to the Board of Supervisors supporting this. One person or two people from this board attending, the Brave Faces.
I've offered my support and
Oh,
I'm
yeah.
very interested in
Oh, yes.
participating.
Yes, you're definitely gonna be there.
Yeah,
I am too, me too.
Okay.
yeah. And in terms of writing the letter to the Board of Supervisors, what is it that you're asking for from the Board of Supervisors?
That's a good question. I haven't made it that for you.
Why don't
If I had someone to ask me those questions legitimately,
let's
I would really love to talk about that,
do it.
because I definitely need to form answers to questions.
It's very overlapped with the work I do as CIT, so I'm happy
Okay,
to work with you on that.
let's do this.
Okay. You know how to reach me.
Okay, oh, yes, I do.
Got you, Vernon.
There is another, event coming up in May, that we're proclamating, or hopefully gonna have it proclamated to recognize our peer support specialists and our peer coaches.
Yeah.
Because the trenches that they are in, is a daily work, and it is definitely difficult to take time for oneself in those situations. Would like to show some support because the state assembly in September, I believe it was, resolution 146 of the state assembly of 2024-2025 session recognized the third week of May as peer support specialist week in the state of California. I have given that proclamation, a resolution, to the Board of Supervisors. There has been a Board Supervisor, Natalie Arroyo, to champion this. Natalie Arroyo and myself, I don't like speaking on her behalf outside of her presence, but in the last meeting has brought up support from this board, to the from the Behavioral Health Board to the Board of Supervisors in support of recognizing this event. Third, the other one I have would probably wait until the communications with the Director of Mental Health. It's about patients' rights position.
I don't have too much to say. One thing I was thinking about a lot this month was the fact that, I was on the board before a number of years ago, and the board, both the committee members and the board has changed a lot. And one of the main ways it's changed since I was last on it is that there's fewer community members at large and more people who are actively working in the field. And personally, I've really liked that because then I can get a lot of information since I'm one of the community members at large people who don't work in the field directly anymore. But I just wanted to say a word of appreciation about the things that are sent out about things that are happening in our local community. Those of us who are community members at large, even people like, was kind of a big wig in the alcohol and drug community when I was working, really need to know these things. And we need to understand them in the context of this county and which is different than like when I was in Sacramento County, tremendously different, you know, so it's like a different world. So, please keep that up. I really need it, and there's a few of us, Tim and a couple of other people who are, you know, we're just people. We're not working in the county anymore, and we're not, you know, in mental health or alcohol and drug, but we're still very involved and interested. And we have to find a way to contribute to this board in a different way than the rest of you can. You know, I can't say that I'm over at Providence's ER like Raphael is, or, you know, something like that. So thank you for doing that and keep it up. I loved that the Tay, thing came out about the open house. And
Yeah.
I intend to go there. Thank you.
So.
I'm sorry, I forgot to say one more thing.
Short time?
So on March 13th is our next SUD meeting. And our speakers that are coming out, our programs that are coming out are New Life Discovery Project and Aegis to come out and share about their program along with a peer from their program. And you can pick their brains. Well, I don't know if you can pick their brains. You can ask questions and they will let you know about that. And then
Is that the SUD committee is part of the board?
correct.
Okay.
Can I add some things for the SUD report if I forgot to? And
Any communication? Oh, I'm sorry. It's all right. My communication is that May 4th, at the Warfinger is the City of Eureka's May's Mental Health Kickoff. And so, we have our speaker, Joseph Reed, coming from Michigan. He's written a book called Broken People. He was at the CIT conference. He is coming with his daughter, his adult daughter and wife, and they are pretty awesome because they have different viewpoints of people with mental health.
Sensing a theme here.
Yeah.
You guys keep coaching the CIT conference. That's awesome.
You can see people on how they present. It's great. Excited. So, more details will be coming on that, but that is, May 4th, which is a Sunday at the Warfinger. We'll have 2 panels, a lived experience and a professional panel and our main speaker. Yeah. So that's my.
You're your Star Wars theme.
I know. Every year. Okay, and with that, we will move into reports. And I saw that Connie was on there and she's gone. So, oh, you know what? We forgot to put DHA's director or Paul.
Or
Well, I would
deputies.
just say, after me, then I can punt it to any of the deputies that are here.
Okay.
Yeah, I think they can all, if they have something to go for.
All right.
Yeah.
So, behavioral health director.
Okay. Gosh, a lot in this meeting today, and I super appreciate all the communication and the sharing and conversations. I had actually thought I would just share a little bit about what Supervisor Madrone already referenced, which was the presentation earlier this week to the Board of Supervisors. I just think it's good information for this group, this board to also have. We had decided to just bring forward, Paul and Jack and I had kind of an overview of behavioral health budget and some of the heavy hitters, like some of the high expenditure areas for us, which are really more in the adult world, which is why it was the 3 of us, not so totally. But so we did a kind of an overview of budget for 23-24. We talked a little bit about some of the heavy hitters, and we also just went through what our core and mandated services are, because I think it's important for the community to understand that. It's not always real evident, I think, from the outside. And then just some of the ongoing impacts to our budget as well as our commitment, our continued commitment to the community. So I'm just gonna do a few of the high level talking points from that. I think you can probably listen, it's public, so you can listen back to the recording if you wanted, or you can see the PowerPoint if it's of interest to you. But essentially, for 23-24, behavioral health had about $64 million in expenditures. That's our budget, which is, you know, a pretty substantial number. And we have a variety of ways that we fund our services through, you know, realignment that we get, Mental Health Services Act that you all are familiar with, and then also drawing down billable services through Medi-Cal from the state, from the feds. And so, and then other things, like we have a little bit of interfund transfer, we have some grants that we're able to leverage at times, we have a small amount of county general fund and just some other things. But the bottom line, which is partly what I wanted to lift to the Board of Supervisors, is for 23-24, which is now last fiscal year, we're still about almost $3 million short. And that's important for us to talk about because we continue to be required to provide certain core services like specialty mental health services. And we continue to have other mandates roll out. Some of them you've heard about, like Care Court or AOT or now SB 43, these other things that we're tasked with. And much of those initiatives are either under or unfunded. So we have to add those to our plate and continue to provide the mandated services without sufficient funding. Some of what we wanted to present this past week was that our highest spenders are sempervirens. We are always in the red on sempervirens. I think for 23-24, we're close to 4 million in the red. And CSU as well, which is kind of linked to sempervirens. And then we have substantial placement costs. So we're responsible for paying for placement costs for people who are conserved or in need of placement with no revenue for those. So $10 million for 23-24 with no viable revenue. So, and I say that because, again, there are certain things that we're required to do, and there are things that we're not required to do, but that are important for our community. But when we can't make ourselves whole, we have to figure out what to prioritize. And I wasn't there on Tuesday, nor am I here today saying, oh, and so we're not going to do these things anymore. But what I'm saying is that we're really looking to figure out how do we continue to serve the community in all the ways that we need to, that we're committed to, that we want to serve the community and still remain fiscally solvent. It's just an incredibly huge challenge for us. And I say, you know, so the $3 million, 2.7 million that we're short from 23-24, we're still working diligently to draw down every single penny. Like that number will move. There's other funding sources that we're still working to leverage to make that, to offset that difference. And it's not great, like it's a challenge. And so I just, I'm working really hard to be as transparent as possible because I do feel like it's important for people to recognize. And both Board of Supervisors and the Behavioral Health Board have been such amazing partners for us when we've had to have difficult conversations and when we've had to communicate with the community about, you know, where we're falling short or where we're struggling. So I just wanted to leverage that partnership a bit in this conversation. And also, like I said, be real transparent about just kind of the state of our budget and the state of how we're currently operating within our requirements and our commitments, you know. So anyway, I thought I would share that today. Thank you.
So you're planting it.
I'm offering for any of the deputies who would like to share, and no pressure or requirements.
I don't have anything to share.
I'll share that Jet DeCruz is retiring, which most of you may actually know her. She used to come to this board, and she filled the role as hospital administrator and many other positions across behavioral health for, I just saw something that said almost 38 years. So she's retiring on April 1st, and we're doing a retirement proclamation with the board on March 28th. And just making lots of plans to welcome that transition and wish her well and It'll be a shift for us. We have 2 senior PMs right now in children, so we'll be trying to fill her role as quickly as we can.
It's a huge loss.
It is a huge loss.
Their institutional knowledge.
And she deserves to retire.
Absolutely.
I think it's March 25th, right? That's the Tuesday,
Yeah,
just so
sorry, I
everybody has
said
the
the
right. information.
28th,
Is
because
the
that's a
party.
retirement party,
Yeah.
but sorry,
Yeah.
March 25th is
Yeah,
the.
is the
Thank you for that.
And she's really navigated and done really good work, both in adults and in children.
exactly.
Again, she's kind of sunsetting her career in children's, which I'm so grateful for, but she is really, her knowledge and experience has spanned all our systems, which is.
She's who hired me
I know,
and sent me to CIT because she didn't want to go.
I know.
And put me in mist. And this is how I became
Yeah.
who I am today.
Wow,
And you have that
there are
story.
a lot of people that have that same
That's
story. Yeah.
Gosh, now I wanna go see her.
I had no interest in working with law enforcement at all. I was scared of them. It's funny.
All right.
Madam Chair,
Yes,
I have a question for the Director of Mental Health.
okay.
On our patient's rights advocate position, can you let us know about where that may possibly be at in the hiring process? The reasoning of asking this question is because the person filling that position is a peer coach level 3, and she is the supervisor of Hope Center, and the Hope Center is paying the price. Big time for that. That's the reason why Brenda's here. That's the reason why some other people from the Hope Center are supposed to be here this morning. But we would like to know if there's any hiring process or where that may be at.
We are recruiting for the PRA position. Yeah, we're working hard to recruit for that position.
Do you have any idea about how long?
I,
Because I'm gonna let you know, we've noticed the times, the Fridays that Betty is out, our peer coach level 3, and Wednesdays she's out. When
hey, Vernon, I'm gonna just pause here, cause I don't feel like this
this
is the
is the
place.
time or the place,
This is,
can we create a time? and
sure, but I
I
don't
would
think
love
this
that.
is the place to talk about individual staff.
place? Okay, well, we need to come to some answers. I mean, and as a board member, I would like to address that because there are a lot of fears at the Hope Center, and those fears are legitimate to Brent and others. And I'm not gonna be afraid to bring that out in any conversation or public meeting.
Yeah, I'm just not able to engage in conversation with you about individual staff in, in a public setting, so I'll just say
So
that.
what would be a good format?
Yeah, I mean, you could certainly reach out individually. You could reach out, I would say, to start with Jack, because he's the deputy over the Hope Center. If you want to reach out and I could have an individual conversation with you, I'm happy to do that
That'd be
too.
great.
Okay, yeah, sure.
Thank you.
Okay. And now, SUD committee update.
I just want to say there was just a few minutes ago, Michelle sent out the thing for March 13th. I want to say that the last little thing that says guidelines for community was actually we were actually working on a discussion, what we want to do about having a guidelines for going into the community or, reviewing communities, treatment programs and stuff like that. So, yeah, that shouldn't really been in there, but those are things that we've been discussing. So these are ongoing discussions in our groups for the past 3 months. And so, what the reason why that's even there was we've been adding and taking away and stuff like that. So if anybody wants to show up on the 13th, and listen about New Life Discovery, excuse me, too much coffee today, New Life Discovery and Aegis, and also, hear about our, what we're talking about as far as how we're gonna handle these reviews. Have some input, be a part of, and also by us having people come to our SUD program, maybe they'll want to be a part of too. So anyways, thank you. That's it. That's all.
Yeah, I just wanted to add some really exciting updates. North Coast Substance Abuse Council is going to be expanding 12 more beds in Henderson Center. It was a very exciting. We went to the planning commission. Very exciting to see how the community responded to that. It was mixed, and but the director for that did a really good job at answering a lot of questions. There's a lot of misinformation about the project and the population. So I'm really glad that he was there. So that's really exciting. Something that's not as exciting is Dr. Bryan from WRS is retiring. So what that means is that they are now raising the bar a little bit more for folks who are who are co-occurring duly diagnosed. So and we are experiencing that now. It's getting harder to place folks. Like I said, we're getting thank God for our partners in other, surrounding areas. There is a project right now that we're working on and trying to expand detox services in Humboldt County. Hopefully by next meeting, I'll have more information on that. But there's also some things that are happening. We've noticed more nitrous oxide and kratom folks coming through the ED. And with kratom, we treat that just like opioids, but with nitrous oxide, it gets really, really tricky. Most folks have to, be treated longer. There's just really no place, so we're having to get really creative with that. But some of these places that they are getting them at are these local smoke shops. And anybody can just go in there and just get as many as they want. It's not regulated. I've had parents, some folks that, did end up in the ED go actually to these places and threaten, to sue them because of what's happening. And I mean, I certainly don't blame them. I mean, it's, but this is just becoming a problem I'm seeing in the community, and just reports from, the patients, how easy and accessible it is. It's very disturbing. So we just wanted to know in everybody's brain and discuss that later. So I think that's all I have.
Be nice to and celebrate Ruby.
Yeah.
Be finished.
Her party's on Monday at 1 at Waterfront. She had her proclamation at the Board of Supervisors this past Tuesday. I was just looking to see, because did the email about her retirement come to this group?
I can see that. Maybe.
I'll find it and send it to Joe.
I guess I want to say, she's been up here for a while. She's a medical person working with different doctors, and she's just dedicated herself, to this, and we owe a lot of gratitude to her.
So it's gonna get tougher than Dr. Bryan.
Dr. Whittington is now the medical director, and he's wonderful.
Okay.
So we're really happy that he's there.
Okay. There's no other committees at this time, so now is the chair, vice chair reports, and I don't have anything. You have a vice chair? Any updates about the navigation center? Airport?
Is there anything about the airport that's new? I'm not hearing anything.
We're just coming along. Yeah.
Wasn't it last time there were 5?
We're up to about 12.
It was actually.
Excuse. So one person, it's hard for me to hear. So side conversations.
We're about 12 per
12
petition
now?
so far.
Okay. Are there any future items to go on the agenda? Your chance to, so I have education, that was a note from Danette.
Will we know more about, do you think we'll know more about any cuts that's happening at the federal level that will be trickling down to affect services here? Potentially in the next month or so, or do you think it'll be slower than that?
I'm not sure, honestly. We're just kind of waiting to see as well. So certainly anything that I hear or we hear, we'll share. Yeah, thank you for asking. It's just kind of unknown right now about the actual.
Yeah, well, I've heard that bad things about part of the Medicaid cuts will be mental health cuts. I mean, I've heard that on TV for the last 3 days.
I think that I feel like the information has been hard to quite sort through and a little bit inconsistent. And so, yes, I think there's lots of worry, but we're still waiting to like really understand the facts.
Things are a bit musky.
I love the way you said that.
What was the word you used? Musky?
Musky.
Thank you. I just want to make sure.
Just saying.
So if there is no other items for future agenda, what? Before two.
You did it again.
13:53, and let's adjourn this meeting, and thank you all for being here, working for your community.
Thanks, Laura. Thank you, Laura. Thank you, everyone.
What is
Bye, Melissa. Bye, everybody. Bye, Zoom. Good to see everybody.